Hello, everybody. I am going to discuss about the blood supply of brain. This is very, very important if you have to understand stroke. And one of the most hello, I'm going to discuss about the blood supply of the brain. It is very important to understand the blood supply of brain if you understand the stroke. So let's start from the very beginning. So the blood supply of the brain can be divided into anterior and posterior circulation. So anterior circulation is one which is anterior and posterior circulation. The anterior circulation is considered one which is originating from the carotid system, and posterior circulation is the one which is originating from the vertebral system or vertebral or it is called the vertebro-basilar system. So the carotid artery originate from the arch of aorta. So carotid artery originates from the arch of aorta. On the right side, it is a direct branch of the brachiocephalic, and on the left side, it directly come from the arch of aorta. So on the right side, the carotid artery, common carotid artery, originates from the brachiocephalic. On the left side, it's a direct branch of the arch of aorta. Whereas the vertebral artery on the right side originates from the vertebral artery originates from subclavian artery. Subclavian artery on the right side originate from the brachiocephalic artery. And on the left side, the subclavian artery originates directly as a branch of the arch of aorta. Now the subclavian artery then give rise to vertebral artery, and which form the posterior circulation. So the part of the brain which is supplied by the vertebro-basilar system is called the posterior circulation, and the part of the brain which is supplied by the carotid system, that is called the anterior circulation. Okay, so that's the most important aspect of the of blood supply of the brain. Now we will go individually, first starting with the anterior circulation. So anterior circulation, as we said, it originates from the common carotid artery which goes along the neck. At the level of the thyroid cartilage, it's divided into internal and external carotid artery. Remember, external carotid artery doesn't supply the brain as such, although it goes inside the skull, but it doesn't supply the brain. So on the other hand, external carotid artery supplies all the structures in the neck, all the structure in the neck. And it also go inside the skull as the middle meningeal artery through foramen spinosum and supply the meninges. Whereas internal carotid artery has got no branch in neck, so it doesn't supply anything in the neck because it is keeping everything, holding everything to go and supply in the brain. So that's why neck is not the priority. So internal carotid artery enters the skull through the carotid canal. It entered the skull through the carotid canal. It comes out of the, it enters the skull in the petrous bone through the carotid canal and comes out through the foramen lacerum into the middle meningeal fossa. Into middle fossa of the cranium. Okay. So I'll draw the course of the artery. So when it comes out in the middle cranial fossa, it goes through the cavernous sinus by the side of the sphenoid bone. It goes upward and forward until it reaches the roof of the cavernous sinus, and it pierces the dura mater of the cavernous sinus and come out in the subarachnoid space. In this subarachnoid space, it's called backward, and then it gives two terminal branches. So middle cranial fossa, it goes through the cavernous sinus. It goes through the cavernous sinus. And then come out in the subarachnoid space, and there it divides into two terminal branches, anterior cerebral artery and middle cerebral artery. So it divides in these two branches. Now let's draw this. Okay, so if we first of all, let's draw the a lateral view of the skull. Just to give the orientation, that's the lateral view of the skull. So the internal carotid artery, which supplies solely the brain, it goes through the carotid canal and comes out through the foramen lacerum. So the way it goes is like this. So it enters the skull through the carotid canal, okay, and coming out through the foramen lacerum. Okay, now if we draw another, so this is the skull cap has been removed, so that's the nose. So this is the sphenoidal bone where the pituitary fossa is. That's the anterior cranial fossa, that's the middle cranial fossa, and that's the posterior cranial fossa, that's the foramen magnum. So this is the foramen magnum. This is anterior cranial fossa. This is middle cranial fossa, and this is the posterior cranial fossa. The artery comes out through the foramen lacerum, that's around here, and the artery goes through the cavernous sinus, until and if we draw the artery like this, it goes forward, upward until it reaches the anterior clinoid process, where it pierces the dura mater and goes into the subarachnoid space. Okay, so the artery goes up like this, and then, okay, so that's the artery. It It then give rise to two terminal branches. One is called the anterior cerebral artery, and then the other is the middle cerebral artery. Apart from that, it also gives rise to ophthalmic artery, which supplies the eye. So it goes through the cavernous sinus. Just let's draw this one as well. So to clarify, so that's where the cavernous sinus is. So the artery is going through the cavernous sinus, like here. The artery is going through the cavernous sinus. It goes through the cavernous sinus and it's ophthalmic artery. Apart from that, there are two important branches of the internal carotid artery. One is the anterior choroidal artery, which obviously supplies the anterior choroidal plexus. Apart from that, it also supplies the optic tract and also some deeper structure in the brain. And we have got posterior communicating artery, which is the again main arterial supply, which is connecting the anterior and the posterior circulation. So this is the anterior cerebral artery, which is traveling along the medial side of the brain, and this middle cerebral artery eventually goes and supply the predominantly the lateral part of the brain. So if we draw, so this is the lateral surface of the brain. So the middle cerebral artery supplies this lateral surface of the brain, comes out and gives all the branches to the lateral surface of the brain, including the frontal lobe, the parietal lobe and the part of the temporal lobe. And then if we look at the medial surface of the brain, so this is the medial side of the brain, this is our corpus callosum. So this anterior cerebral artery, which supplies the medial side of the brain, it supplies the medial side of the brain. So if it supplies the medial side of the brain, so if we make this anterior cerebral artery as the blue part, so that will supply this part. So the medial side of the brain, the orbitofrontal part, all this part is supplied by the, so let's give this is the anterior cerebral artery. That's the supply of the anterior cerebral artery, which is supplying the corpus callosum as well. So that's the full supply of the anterior circulation, which is supplying the, on top of that there are perforating arteries from the anterior cerebral artery, which supplies the anterior part of the basal ganglion and also the internal capsule, and also there are lacunar arteries which are supplying the corpus callosum. So this is the corpus callosum, which is supplied by the anterior cerebral artery. The middle cerebral artery supplies, it has got four parts, and I'm going to discuss that. So what are the four parts? So this is the coronal section of the brain. This is the coronal section of the brain, and that's our That's our middle cerebral artery. So from the origin, from the internal carotid artery up to the insular cortex, it's called the M1. The part which is in the insular cortex is called the M2. The part from the insular cortex up to the Sylvian fissure, that's around here, is the M3, and the part which is distal to that is the M4. Okay, so this is the M1 part which is from the origin up to the insular cortex. The part which is in the insular cortex is called M2. The part from the insular cortex up to the Sylvian fissure is the M3, and the part beyond the Sylvian fissure is the M4. Now, why is it important to know that? Because if you remember the total anterior circulation stroke, which is where the patients have higher mental function abnormality related to anterior circulation, they have got weakness or sensory impairment, and they have got homonymous hemianopia with macular involvement. That's if the M1 or M2 artery is involved, that gives rise to total anterior circulation stroke. Whereas if the M3 or M4 is involved, it usually gives rise to partial circulation stroke. And the lacunar anterior circulation stroke is caused by for the anterior circulation, it is caused by either the, so that's the lacunar artery from the middle cerebral artery supplying the deeper structure. So lacunar anterior circulation is caused by the lacunar arteries coming from the middle cerebral artery and the anterior cerebral artery. So lax is caused by the lacunar arteries, which can be in the either in the middle cerebral or the anterior cerebral, that gives rise to lax. And the symptom, as you may recall, they can have weakness or sensory impairment, either in combination or individually due to involvement of the internal capsule. They can have isolated ataxia because of involvement of the basal ganglion or the corpus callosum. So that is in short the anterior circulation. So if we recap, the anterior circulation is the carotid system. It originates on the right side, the common carotid through the brachiocephalic. On the left side, it's a direct branch of the arch of aorta. It goes along the neck. It divides into internal and external at the level of the thyroid cartilage. External supplies all the structures in the head and neck. Hence, it has got branches in the neck. All the branches which supplies the head and neck is supplied by the external carotid artery, whereas internal carotid artery in the neck has got no branch. It enters the skull through the carotid canal. It comes out through the foramen lacerum. That it enters the cavernous sinus. It goes upward and forward until it reaches the roof of the cavernous sinus in the anterior and around the anterior clinoid process. It pierces the dura mater and comes into the subarachnoid space. It rolls backward and then divides into a terminal branch of anterior and middle cerebral artery. There are other important branches of the anterior of the internal carotid artery after it pierces the dura mater. They are the ophthalmic artery. They are the anterior choroidal artery and posterior communicating artery. Now, the middle cerebral artery supplies the lateral side of the brain and the deeper structure, and it's divided into four parts: M1, M2, M3, M4. M1 and M2. M1 is from the origin up to the insular cortex. M2 is the part which is in the insular cortex. M3 is from the insular cortex up to the Sylvian fissure. M4 is beyond the Sylvian fissure. If M1 or M2 is affected, it causes total anterior circulation. If M3 or M4 is affected, it causes partial. And the lacunar artery, if it is affected, it's cause lacunar anterior circulation. On the other hand, anterior cerebral artery goes upward along the medial side of the brain and supplies all the medial surface, including the orbitofrontal cortex and also the corpus callosum. And also some anterior deeper structures of the basal ganglion and internal capsule. So that is in short the That is in short the anterior circulation. Now let's move to the next page. So if we now go to the okay, now let's go to the posterior circulation. The posterior circulation, as we have already said, that it originates from the subclavian artery, which on the right side is a branch of the brachiocephalic, and on the left side it's a direct branch of the common carotid artery. So these are our subclavian artery. So that gives rise to the vertebral artery. Vertebral artery goes in the neck through foramen transversorium. So it goes through C6, C5, C4, C3, C2, and then C1. Okay, the artery climbs up through this foramen transversorium, sorry. Climbs up through the foramen transversorium and then enter through the foramen magnum and enters through the foramen magnum. And after it has entered through the foramen magnum, which is at this level, it joins with the other vertebral artery at the pontomedullary junction to form the basilar artery. So the vertebral artery enters through the foramen magnum and join at the level of the pontomedullary junction to form the basilar artery. Okay, so that's the basilar artery. So if we just, so if that's the midbrain, pons, and the medulla. So the branches of the vertebral artery are the following. It supplies the, it gives rise to two branches of the anterior spinal artery, which supplies the anterior two-thirds of the medulla as well as anterior two-thirds of the spinal cord. It also gives rise to two posterior spinal artery, which supplies the posterior part of the medulla, and it also gives rise to another important artery, which is called the posterior inferior cerebellar artery. So if this is the cerebellum, so this artery gives rise to posterior inferior cerebellar artery, which supplies the posterior inferior cerebral part of the cerebellum plus the lateral part of the medulla. So if this is a very important artery, is one of the commonest type of the posterior circulation stroke. If this artery is affected, you get what is called the lateral medullary syndrome. Okay. Now coming on to the branches of the basilar artery. The terminal branches of the basilar artery are the two posterior cerebral artery, to posterior cerebral artery, which supplies part of the midbrain, top of the midbrain. On top of that, it supplies the whole of the occipital lobe. It's so if this is the lateral view of the brain, and this is the medial view of the brain. So this is our so if we put green mark for the or what okay, green, so the whole of the occipital lobe is supplied by the, and if we see that's the lateral side, and on the medial side it is supplying the deeper part of the temporal lobe except the part of the uncus. Okay, so that's the supply of the, this is the posterior cerebral artery. Then there are few more important branches of the basilar artery. So if we go back, so these are the small paramedian artery, these are called the pontine arteries. Then we have got this important artery which is called the superior cerebellar artery, and then we have got the inferior cerebellar artery. So if we just write it down, so this is superior cerebellar artery, this is anterior inferior cerebellar artery, and obviously this is the posterior cerebral artery, and these are the paramedian pontine artery or perforating artery. On top of that, there is a very important branch which normally comes from the ICA, but sometime it can be a direct branch. Most of the time it's a branch of the ICA, but sometime it can come, so it's most of the time it's a branch of the ICA, but sometime it can come from this basilar artery as well. This is called the labyrinthine artery. So if I'll show exactly how does it go in this skull. So if this is again the view of the skull with the upper cap taken, this is the nose, these are the ears. So this is our sphenoidal bone, this is the anterior cranial fossa, this is the with foramen magnum, this is that's the foramen magnum, so that's the posterior cranial fossa. There is a foramen here called internal auditory meatus. So the artery which originates either in the basilar artery itself or in the inferior cerebral artery, they go through the internal auditory meatus along with the facial nerve and the 8th cranial nerve, and go on to supply the inner ear. So we draw this. So this is the middle cranial fossa, and that's where the artery is supplying. So that's the inner ear which is supplied by this is called the internal auditory artery. So in short, these are the branches of the posterior, all this part of the brain. So the part of the brain which is supplied by these branches of this vertebrobasilar system is called the posterior circulation. To summarize, the vertebrobasilar system originates from the subclavian artery. On the right side, it's a branch of the brachiocephalic. On the left side, subclavian originate directly from the arch of aorta. After the origin From the subclavian artery, vertebral artery goes through the foramen transversorium from C6 to C1. Then it enters the skull through foramen magnum. It travels upward. Both the vertebral artery at the level of the pontomedullary junction joins to form the basilar artery. Basilar artery travels up. At the top of the midbrain, it divides into two posterior cerebral artery. Branches of the vertebral artery include anterior spinal artery, which supplies the anterior two-thirds of the anterior part of the medulla, along with the anterior two-thirds of the spinal cord. Posterior spinal artery, which are branches of the vertebral artery, supply the posterior part of the medulla along with the posterior part of the spine, posterior one-third of the spinal cord. And also there is another important artery called posterior inferior cerebellar artery, which not only supplies the posterior inferior part of the cerebellum, but it also supplies the lateral part of the medulla. The branches of the basilar artery are the following: the terminal branches of the posterior cerebral artery, which supplies the whole of the occipital lobe. It also supplies deeper part of the temporal lobe and the medial surface, except the part of the uncus, and it also supplies the deeper structure in the forebrain and the diencephalon, which includes the thalamus, part of the internal capsule, part of the and other deeper structures. The posterior cerebral artery also supplies the top of the midbrain. Then the other branches of the basilar artery are anterior inferior cerebellar artery, which supplies the anterior inferior part of the cerebellum along with part of the pons. And then we have got the superior cerebellar artery, which supplies the superior part of the cerebellum and part of the midbrain. And we have got the internal auditory artery, which more often come from anterior inferior cerebellar artery, but sometimes it can come from directly a branch of the basilar artery. It enters through the internal auditory meatus and supplies the inner ear. This is